hit go.
It's running.
All right, so Rusty, tell everybody your name.
Rusty Gilliam.
And-
Pastor Rusty Gilliam.
That's right. So he's actually a veteran, so we thank him for service for the country.
Thank you.
And he's a hard-working farmer. And you're how old?
73.
73. So Rusty had some bad shoulders that he couldn't hardly lift and bend and use for years.
Years.
And last year, probably not even 1 year ago, in November, we put a regen shot in the right shoulder. Now, in the beginning, tell him, pain-wise, how bad did it hurt before the shot?
I couldn't go no higher than that, and I couldn't go no higher than that. It was.
And the
just
pain was pretty severe.
I couldn't sleep on my shoulders. I had to sleep on my back or in the chair.
All right, so it's been not quite a year, but he said about 3 months after the shot. Show him what your range of motion is.
I can go all the way up, back over, in fact, if I want to. I got full range this way. I've got full range this way.
And pretty good strength when you're pulling or lifting on
Good
stuff. Doesn't
strength.
really hurt.
Don't hurt. And then
Now-
I can go all the way back like this.
Now, unfortunately, his other shoulder, the VA beat me to it. They called him and said, hey, we can do your shoulder replacement. And they did that in April of this year, 2025. And you went through 1 round of therapy or 2?
I'm on my 3rd round.
You're on your 3rd round. Okay,
round.
I didn't know they put you in another one.
They
Okay,
put
so
me in
he's doing 3 rounds of therapy. Show him the difference. Show him what you got. And this really should have been good after the 1st round, but they're having a problem. Is why you're doing more therapy.
Right.
But show him what
So
you got.
I can go. That hurts real bad right there. That starts hurting. I can go. I can force it, but I can just barely go back like that, and I can just go. That's about it right there. Where this one I can do anything,
Yeah.
and so
Big difference.
big difference.
Huge
In
difference.
fact, the physical therapist said that it just amazes him on this shoulder because other therapists worked with me before I had anything done, and they said that I couldn't do anything, and it was bad. So
They're thinking this is almost a miracle.
they thinking this is a miracle. What they're thinking, because I had a big knot right there. If you remember,
Yeah.
there was a big knot right here where the muscle had tore or something and pulled, and it was terrible. But it's all, I'm really well pleased with it. I never
Yeah.
would have thought it.
And when they get through messing with this, we might even come along and do a regen shot on this side and try and get this one as good as this one.
Right.
So when they get all done, if they can't get it any better, you get with me and we may be doing another one on this side. But you would recommend this to other people
Yes.
without
But-
hesitation.
Without hesitation, but it's not an overnight thing.
Yeah, it's not instant.
It's at least 90 days.
Yeah.
Before you start really feeling the difference. I felt the difference when I went to bed one night and I turned over and it didn't hurt.
Yeah.
And I said, I can sleep on my side again. And I was just flabbergasted because it just,
You hadn't been able to do that for how many years?
forever. It's just
At least 10 years?
at least 10, because the VA been fighting with me with this for over 7. So
Yeah.
And so I highly, highly, highly recommend it. In fact, I recommended it to my veteran buddy, my brother-in-law in Hattiesburg last night. They told me he had to have a shoulder replacement. I begged him. I said, please. I said, check into this, and I told him all about it. And so yes, I would recommend it. Because you don't have the downtime with the surgery.
Right.
You don't have the downtime with the surgery. You don't have to be put out. It's all just a little shot, and
And it's just so much better.
just so much
Just so
better.
much better.
Yeah.
All right. We're good, Mike.